Hi everyone, today we are going to talk about psychosis. And first, we study the definition of psychosis. Psychosis is a mental disorder characterized by disconnection from reality. It affects the way your brain processes information. For example, you might see, hear, or believe things that aren't of reach. For example, for the case of hallucinations, delusions, and disorganized speech. We move on to stages of psychosis. We have three stages, that is the prodromal period, acute period, and recovery period. Prodromal period, this is the first stage where the individual change the behavior. For example, the way he or she act or think. This period lasts for days, weeks, months, or even years. The second stage is the acute period. This is the second stage when the symptoms begin to occur. For example, hallucinations, delusions, and disorganized speech. And this is the stage where we normally recommend for treatment. Recovery stage. This is the third stage, and it lasts for few weeks to few months. This is where the patients may fully recover or the symptoms he or she had become less intense. This staging happens when somebody has already received the medications, and that's why he or she experiences the full recovery or have the symptoms become less intense. Next, we move to the symptoms of psychosis. We categorize them into three: positive symptoms, negative symptoms, and cognitive symptoms. They are positive symptoms. We call it positive symptoms because they add an additional behavior to a person. I begin with hallucinations. Hallucinations can be auditory, tactile, or visual hallucinations. Auditory hallucinations is hearing voices when no one is around. For example, a person can be hearing somebody calling him or her, and they will sense that person is not there. Tactile hallucination is strange feelings that you can't explain. This is where a person can have feelings such as feeling that the internal organs of the body, such as the kidney and the heart, are moving around. Visual hallucinations is where you see people or things that aren't there. This is where a person can see someone breaking into his car or his house and trying to take something, and therefore making these people to become very uncomfortable. Delusions. These are the false beliefs that aren't in line with your culture and that don't make sense to others. For example, the patient may think they are the president of a country, or they may have power to bring people back from death. The delusion a psychotic person has is, for example, having believed that the medication being given to him by the doctor is meant to poison him. And then we move to unusual psychomotor behavior. The person makes unintentional movements such as pacing, tapping, and fidgeting. The next slide is the continuation. That is, the fourth one is the catatonia. This is where the person becomes unresponsive in his or her daily functioning. Disorganized speech and thought, difficulty in concentration, and thought processes. This is where somebody does not follow a certain conversation, or when somebody is communicating to he or she. Negative symptoms. Negative symptoms is that it alters the normal functioning of an individual. In that, the individual starts experiencing difficulty in thinking or coming up with ideas, little display of emotions, reduced socialization with friends and family, reduced inability to complete tasks, and among others. Cognitive symptoms: there is decreased attention, decreased speed of processing information, decreased reasoning and thinking abstractly, and decreased learning. Causes of psychosis. Psychosis has many causes. Among them are the genetics, that is from the family history. One of the members might have suffered from psychosis, and therefore giving him the likelihood of acquiring psychosis. Another one is the drugs. For someone who abuses marijuana, he or she can develop psychosis. Trauma, that is the death of the loved one, somebody might develop psychosis. Injuries and illnesses: traumatic bad injuries, brain tumors, stroke, Parkinson's disease, dementia, and HIV can all bring psychosis. Hormones: some people experience postpartum psychosis after giving birth. This is only applicable for mothers. And finally, we move to the treatment of psychosis. Psychosis is destructive, but treatment is available to help people manage it. For example, the use of antipsychotic drugs and the use of therapy. This marks the end of today's lesson. Until next time, bye.